What's with the title, Acupuncture has limited benefit for chronic pain? I think that doctors tend to poo-poo things that they don't really understand. I mean, doesn't common sense just tell you that it works? It's been around for 5,000 years.
Yeah, of course it does. We generally have kind of a bad attitude about almost every discipline, but then the other disciplines sometimes have a bad attitude about doctors too. Yeah. And both have a point, because our goal should be to stretch our boundaries beyond what we're taught in our training so that we can open our minds to consider other disciplines, no matter which discipline is our own.
And the doctors are saying that acupuncture is really the placebo effect. And yet, how can they have the nerve to say that when there's a placebo effect with medicines?
Well, that part's true. I think they exaggerate that a bit. There was a study done out of Sloan Kettering that was published in the Archives of Internal Medicine in September of 2012. And basically, they put together a study that's a retrospective study, meaning they looked at a whole bunch of studies that were done, about 29 of them, and about 18,000 patients. And from that study, they tried to determine how many people got better with just the acupuncture alone, how many got better with sham acupuncture, and how many got better just because they were in the control group and in the study. And what they found is about half of the people who had acupuncture had about a 50% response to it, or maybe a little better. And 43% of the people who had sham acupuncture got better, so it didn't leave much of a difference between the two. And 30% really got better with placebo alone. So what we're looking at is an approach that says there's not a real powerful effect of the technology itself, but people do seem to get better somewhat.
And why not try it first before you resort to things like surgery and invasive procedures or even pain medicines?
Oh, well, look at the pain medicines we use. You know, you just look at the NSAIDs, you know, things like Advil, Aleve, and Celebrex, and all the other 20 that are out there. I mean, 30,000 people a year die from that, and 300,000 are hospitalized. How many people do that with acupuncture, Vicki? Are there any?
And you know, too, when you talk about the placebo effect, I remember the first time that I ever had acupuncture, it was really because a friend of mine told me that it helped her horse.
Yeah, really.
And I thought, there couldn't be a whole lot of placebo effect with a horse.
But I think there'd be as much, but there might still be some, that's right.
But the doctors do admit that it does help some chronic pain, like with back pain and shoulder pain and that sort of thing. But they also say that a lot of the benefit is placebo, so they're very critical of that.
Yeah, I think they're putting it down, and I think it's because we just don't understand it so well. But more so, it's because we get locked into the way we think about our own discipline. We think it's the best. So when you're trained in medical school and your residency and fellowships after that, you're trained to think about what drug can fix what symptom. You're not so much thinking about other disciplines. And if you have a narrow mind about what's possible to use in helping your patient, then you're simply going to limit the number of possibilities that might be useful, and some of them may be what makes the difference of whether someone gets better or doesn't.
And just because you don't understand it doesn't mean that it can't work.
A lot of things we don't understand. I'll have to say most illnesses we really don't understand. What we do know from our studies is when we use a certain drug, a certain thing happens. And even then, many drugs are brought to market, and of those, about 20 or 25% within 2 years are off the market because they turned out to be a problem, or they've got a black box warning on them that says this drug could be dangerous in that setting.
Also, many times in Western medicine, the doctors are trying to mask the symptoms. And acupuncture really does try to get at the cause of what the pain is.
But it does, and that still remains to be proven, but I think people appreciate what acupuncture does, and there are millions of people who use it on a regular basis.
I remember that first time that I had gone for acupuncture, and I've had many acupuncture treatments. You went with me, and the doctor gave you this book on meridians and all that.
It looked so confusing.
Yes, it sort of reminded me of like how the central nervous system must seem to Chinese doctors.
Or to me when I was going through a neuroanatomy, for sure. Well, one of the things that stuns me is that back around the time of 1970, President Nixon went to China, and he learned something about acupuncture and Chinese medicine. And he brought back a video that was widely distributed throughout the U.S., and what it showed was somebody having a major operation under the effect of only the needles from acupuncture, and no other analgesia.
And he was eating an orange?
He was eating an orange. They looked pretty happy while the doctors are doing their work. And at that point, I thought, surely we'd bring that forward into our practice. And now it's been over 40 years, and it hasn't happened in any significant way.
I know one time I had a real painful thumb. It was from a repetitive stress injury. And I went to the orthopedist, and this was in the days before we were doing the photon stimulator and so forth. But I had gone to somebody that did Chinese medicine, and she tried some acupuncture, and unfortunately it didn't work. So I went to the doctor, and I made the mistake of saying, well, I tried acupuncture and it didn't work, so I wanted to see if maybe you could give me an injection of cortisone because it hurt so much. And right away he was like, acupuncture?
Yeah, right.
Why would you go for acupuncture? And I thought, I can see why people don't want to admit it to their Western doctors when they go for complementary alternative medicine, because they get a reaction like that.
Exactly. Well, the way we treat pain in Western medicine is kind of aggressive with drugs that can be dangerous. Some of the drugs that we use, particularly the TNF-alpha inhibitors, things like Humira and Enbrel and Simponi, are quite dangerous. In fact, after 5 years, 1 in 33 patients will die from the complications of it, and maybe only half of the people who take it will be helped in a significant way. And there are many side effects with infection and bowel problems and other things that are major issues. So why someone would want to choose that over something like acupuncture is beyond me.
Because acupuncture's safe. In fact, I know that I've fallen asleep during acupuncture.
Right, right. All right, so what we're talking about here is that mainstream medicine needs to take a fresh look at systems other than their own. We need to stretch ourselves beyond the boundaries of what our training was like, and maybe at times even put it aside so we can learn what some of the new disciplines are all about. And if the other disciplines will do that as well, we can work together in something called integrative medicine, where we do the best thing we can for our patient, have the most options, and probably the best results.